Welcome everyone to another wonderful episode here at Jaws Podiatry. We're here in our office-based surgical suite. We have the presence once again of Dr. Gabe Saloom, plastic surgeon. Today we're performing an adipose-derived stem cell injection. We have spoken about these injections in the past. The fat, right? Just go back to physiology 101. Fat contains stem cells. Bone marrow contain stem cells. So you can either get the stem cells from either fat or the bone marrow. I like to use the fat instead of the bone marrow for other reasons. So what we're going to go ahead and do, we have this young gentleman who recently presented to our office with for a third opinion. A third opinion. The patient went to see one clinician, then went to see a second clinician who recommended surgery, and then he came here to us, and what I recommended was to try, in order for him to avoid the knife, to try the adipose-derived stem cell injection, to continue our efforts to maximize improvement and minimize any potential long-term complications. I've made it very clear to the public that these injections, these regenerative injections, are not miracle injections. We're trying to make something better. Very, very, very important. How do we define success? If we can make something 50, 60, 70, 80% better, that's how we define success. So without further ado, the patient has a tremendous amount, and I will show everyone, he's got a tremendous amount of degenerative joint disease in the midfoot. Okay, just to show everyone here. Basically, this is the foot. These are the metatarsals. This is the mid-tarsal region. Okay, side view. All of this. Okay, he's got a lot of arthritis. Arthritis equals inflammation, and inflammation equals pain. So that's exactly what we're going to do. So without further ado, first part of the procedure, Dr. Saloom will be harvesting the fat using lipoaspiration technique. It is not liposuction. It's not like the machine. Right? So
no, that's okay. Just
okay. So basically, what Dr. Saloom is doing is harvesting a little bit of fat. Okay. This is again lipoaspiration, not liposuction. And again, we don't need a lot. We're going to be mixing this the fat with PRP, platelet-rich plasma. Okay. Very clean fat. Messy, really clean.
Another 10 cc. Okay. Not feeling that, correct? Okay. Should be pressure, but no pain.
Are you there?
And you're witnessing another.
I texted Dan, you texted back.
He texted you back?
Yeah,
Did he recognize us?
of course.
That's awesome.
He sends us that.
Excellent.
You should be good here. I mean, pretty good.
Yep. Is bed? Is the PRP ready? So we've isolated the PRP. Now we're going to go ahead and mix the PRP very carefully with the isolated harvested fat. Looks like baby food. We're going to go ahead and inject this baby food right into the affected area. Just kind of just putting everything in there. Again, PRP, and then okay. You know, we've marked the areas pursuant to the MRI. The patient has severe osteoarthritis, degenerative joint disease in this area here, all around this area as previously mentioned. So what we're going to go ahead and do is, you know, we like to use a 1 cc syringes, and we're going to go ahead, just ask the patient just to relax a little bit. There we go. I'm just using this peppering technique. Okay. You got 18. Slowly. There we go, patient. Thank you very much.
Oh, my pleasure.
Okay. We've basically done is we're done with the procedure. We harvested the fat from the patient. Again, the fat contains stem cells. We took the fat, we mixed it with PRP, which was also harvested at the beginning of the procedure, and then we infiltrated the baby fat, right, everything, into the patient's foot. And just like this procedure, you know, we have the abilities and capabilities to apply these principles and these techniques to other clinical presentations: Achilles tendonitis, plantar fasciitis, you know, arthritis of the knee. The sky's the limit. You know, we've spoken about fat pad restoration. That's something that we definitely focus our efforts a lot on. You know, for any type of fat pad atrophy on the bottom of the foot, for a condition that's known as metatarsalgia. You know, these. You know, I've always loved the regenerative medicine. I think that if for all the individuals out there that have been suffering, battling any type of clinical presentation, and they're just so, you know, they're kind of on the fence whether or not to go under the knife, whether it's, again, arthritis of the knee, you know, maybe there could be the opportunity to make something a little bit better before you get a total, you know, knee replacement or a partial. So, you know, again, I think this is a great procedure for a lot of great reasons. I'd like to take this opportunity to thank the patient for allowing us to film this segment. I'd like to take this opportunity, as always, to thank Dr. Gabriel Saloom, Saloum. Please look him up. He's absolutely wonderful and fantastic. And you know, for all the non-subscribers, please subscribe. If you've enjoyed this video, please give us a like. Comments are are welcome. I will try my best to try to get to each and every one of them, as I always do. And most importantly, make sure that your notifications are definitely on. We will continue to upload videos to our YouTube platform. As always, www.jospodiatry.com, Instagram, Jospodiatry, and last but not least, our YouTube channel, Jospodiatry. Have a wonderful day.